The Daily Bruin spoke with the new executive director of the Arthur Ashe Student Health and Wellness Center about COVID-19 safety protocols for the fall.
Hello, I am Dr. Chaitali Mukherjee, and I am the new executive director of the Arthur Ashe Student Health and Wellness Center.
Thank you so much, Doctor. So just to start, one question that a lot of students have is how do they notify the Ashe Center and UCLA that they've been vaccinated before the start of the fall quarter?
Well, first, I just want to express my strong recommendation that everyone who is eligible to safely receive the vaccine, make sure they do it as soon as possible. It's really important for the safety of our students and the whole campus community to do so. As you know, the vaccine is free, no matter where you get it. And we are actually offering vaccine appointments at Ashe. So I encourage anyone who is interested to either, go to vaccines.gov to schedule an appointment someplace close to you, wherever you may be coming from. And once you do receive your COVID vaccine, the way that you're able to update the Ashe Center of your status is to just make sure you keep the document to prove that you've received it. It's usually a vaccine card, and it can be uploaded to the medical clearance section of the Ashe Center patient portal. And all you need to do is go to the main Ashe Center webpage, studenthealth.ucla.edu, and find a link to the portal in the upper right corner. And so all the instructions are there for how you can upload the documentation.
And moving to COVID-19 testing, what do the protocols look like at the start of the year?
Well, the plan right now is that any student who lives on campus, regardless of their vaccination status, will be tested immediately upon arrival. And then another test will be done 5 to 7 days after they arrive, and that's only for those who are in housing. Right now, UCLA is requiring twice weekly testing for anyone who's unvaccinated, who's here with an exception, and that includes the students, faculty, and staff. Anyone really who is living, learning, or working on campus is subject to that twice weekly testing if they're unvaccinated, but cleared with an exception. Regular surveillance testing, though, is no longer mandatory for people who are vaccinated and those who remain asymptomatic.
And now we're about 2 weeks away from the start of the fall quarter. Do we expect that the Delta variant might shift any of the plans as of now?
Well, the current answer is no. There are no major changes planned. And at Ashe, our sole focus is your health, but we are very closely working with the UCLA COVID-19 Response and Recovery Task Force to help develop the policies for classes, housing, and other aspects of campus life that may be impacted, and also working very closely with local, state, and federal public health authorities.
So now that we are returning to campus, it's a difficult time. Do you have any advice on mental health resources that students can access as they return to in-person learning?
Well, I can tell you it's just so important to have a lot of compassion for yourself and each other. That's a first step. There has been a lot that has happened over the past year and a half. And what I can tell you is that our colleagues at Counseling and Psychiatric Services, or CAPS, have been doing an outstanding job of preparing to provide mental health resources as people return to campus. So CAPS is going to be offering both in-person and telehealth services this fall to all registered students. They have short-term triage appointments, individual counseling, clinical coordination. Anybody who needs referrals to longer-term care or crisis support should be directed to CAPS in order to seek out those resources.
And now moving towards the deadline of getting the vaccine 2 weeks before the start of fall quarter, if someone is unable to do that and meet that requirement, what should they be doing?
So students must meet a deadline of September 9th to provide documentation of vaccination against the COVID-19 virus. That deadline applies to all requests also for an allowable exception for medical, disability, or religious grounds. And students who fail to comply with this policy will not be able to live in university-owned housing, will have an enrollment hold placed on September 10th, will be restricted from some campus services on September 10th, and may even have their fall classes dropped on October 4th. If there are some students who must arrive without being fully vaccinated, they should reach out to the Ashe Center now to show documentation that they have a plan to get vaccinated upon arrival.
And what should international students do if they haven't had access to COVID-19 vaccinations in their country?
Well, actually, alongside of our colleagues at the Ashe Center, we're working very closely with international students to understand the details of their vaccine status. As I mentioned, we have staff nursing team members that are communicating directly with the students to review the vaccinations that they may have received or partially received in their country of origin, and to help them as they make their preparations to travel.
And with the UC policy about flu vaccines, when should students go and get their flu vaccine?
Well, the UC immunization policy right now requires incoming students to get vaccines and screening for a lot of easily transmitted diseases such as measles, mumps, rubella, chickenpox, Tdap, and tuberculosis. As far as for influenza, it is recommended that folks complete their entire vaccine requirements before they arrive on campus. But because flu vaccine is more seasonal and it may not be available in the locations where students are coming from, there will be a flu fair that's going to be held at Collins Court at the John Wooden Center from September 20th to October 1st. So at that fair, all required immunizations, including the COVID-19 vaccine and influenza, will be available. And due to COVID-19 precautions, however, no walk-ins will be eligible to participate, and students must make appointments in advance.
And what's the expected policy for students who are exposed to COVID-19 when they're on campus?
LA County Department of Public Health has issued guidelines for institutions of higher education, and there is what's called modified quarantine. So for students who are fully vaccinated, who may have an exposure in a classroom, they will be allowed, as long as they remain asymptomatic, to go to and from class during the period of quarantine 10 days. They may be released from that if they get a negative COVID test 3 to 5 days after the exposure.